Moving on now to Domain 2, stakeholder involvement. So item 4 is the guideline development group includes individuals from all relevant professional groups. So the guidelines should specify which people were part of the guideline development process and what their roles were. Now, this doesn't take into account people who may have externally reviewed the guideline or people who are the target population of the guideline, so not taking into account patients in this item. And areas where you might find this information, maybe in the acknowledgement section or the methods section or even in the appendices. And you should expect to find information relating to each member's name, expertise, their discipline, their institution, i.e. which hospital or university they work at, their geographical location, and a description of their role in the guideline development group. And this item is about ensuring that all the relevant stakeholders were included in the development process. For example, if we were to take guidelines relating to bite wing x-rays in dentistry, we would expect to find specialists in x-ray, radiographers perhaps, but also general dental practitioners, the people who apply a lot of these x-rays to the patients. And this is something that you would have to think about with your co-reviewers as to who are the key stakeholders and who should be included in the guideline development process. Item 5, the views and preferences of the target population, so patients and public, etc., have been sought. It is important to include the views of the target population within the guideline development process. This helps to improve the quality of guidelines by ensuring that the recommendations are acceptable to the people that they will be applied to. And there are a number of ways in which patients and the public might be included in the development process. So there could be formal consultations, for example, to determine priority topics. There may be participation in the guideline development group itself, or patients might perform an external review of the guideline or draft documents. Alternatively, the views of patients could be collected in the form of interviews or from literature reviews of qualitative studies where patients have given their preferences and experiences. Now, there should be some evidence that this process has taken place and that the views of patients and the public have been properly considered. So you might find this type of information within the scope, methods, guideline panel member list, external review, or target population perspectives sections. And you should be looking for a strategy that has been used to gather patient or public views, the methods as to how this was done, and the outcomes of the consultation, as well as how this informed the development. Item 6 is the target users of the guideline are clearly defined. So it should be immediately obvious to the reader who the target population is, and this will help people to understand whether the guideline is relevant to them or not. For example, the target users for a guideline on lower back pain may include GPs, neurologists, orthopaedic surgeons, and physiotherapists. And you might find this information in sections titled Target User or Intended User. And what you're looking for here is a clear description of the intended guideline audience and a description of how the guideline may be used by the target audience, whether that's to inform clinical decisions or to inform policy or to inform standards of care.